Monsome News Agency informs.
At today's 11 a.m. daily press briefing of the Ministry of Health, Ho, director of the National Center for Communicable Diseases, confirmed 13 newly detected cases of COVID-19. On April 13, yesterday, the National Center for Communicable Diseases conducted 502 tests for coronavirus, and 13 Mongolian students aged between 19 and 23 who arrived from Russia on April 11th tested positive. The patients, except one, was under isolation at the center in Ulaanbaatar, separate from one another, and one patient who was staying at an isolation facility in Tarhangawal was brought to the National Center for Communicable Diseases today to begin treatment. It was earlier reported that on April 11th, Mongolia allowed entry to 282 Mongolians who traveled to Ulan, the city of Russia, from Moscow and Irkutsk cities to return home, as Mongolian borders are currently closed to all passengers due to the COVID-19 pandemic. 20 of them were put under separate isolation due to suspicious symptoms, and one of them was confirmed to have diagnosed with COVID-19 yesterday, making the total number of Mongolia's coronavirus cases 17 as of April 13. And the 13 people who were tested positive for the virus most recently were all found to have come into close contact with the 17th patient. Mr. Nemhu also announced that one more coronavirus patient has recovered and was released from hospital yesterday, bringing the total number of people who have fully recovered to 5. The previous 4 recovered people are already discharged from the hospital, 2 of whom are self-isolating themselves at home, and the remaining 2 are staying at isolation facilities under medical supervision. All of the recovered patients will be tested for COVID-19 frequently, says the Health Ministry officials. Currently, there are 25 people infected with COVID-19 being treated at the National Center for Communicable Diseases, and all of them are in stable condition.